What is occupational therapy? Take a moment to think of what you did today. Have you taken a shower, gotten dressed, or maybe you've cooked for someone else? If you can say that you've done any of these types of things, you have completed an occupation. What people don't always think about is what all goes into therapy. What is wrong with a person's balance? Are you able to stand up? Can you transfer from one place to another? What if you have an injury that requires a splint? Who makes this splint? This is where occupational therapy comes into play. Occupations are meaningful activities that are completed every day. There are many occupations that are found within the roles that a person performs on a daily basis. Are you an athlete, a spouse, a parent, a musician, or even a student? Some people may wear more than one hat a day. Within these different roles, our responsibilities or occupations must be performed whether we are injured or not. So how do we perform these different types of occupations with an injury?
Occupational therapy helps people across the lifespan participate in things they want and need to do through the therapeutic use of everyday activities, otherwise known as occupations. It is the use of assessment and intervention to develop, recover, or maintain those meaningful activities of individuals, groups, and communities. We ask, what matters to you, not what's the matter with you. Occupational therapy services typically will include an individualized evaluation, where your situation will be evaluated, including input from you, your family, a care provider, or even a friend, in order to develop individualized goals that allow you to resume or pursue your valued occupations. After you develop goals with your occupational therapist, you will work together on a customized intervention plan to help improve or maintain your ability to perform those daily activities and reach your goals of getting back to your life. Then an outcomes evaluation will eventually be performed to ensure that those goals are being met and potentially see if there are changes that need to be made. Let's look at some intervention examples. Occupational therapy can work with children with disability or delays, participate in school and social settings. They can teach and implement pacing and energy conservation strategies to individuals with a chronic medical condition, such as a heart condition, so that they can continue to do the things that they need to do to live independently. Can educate and train people on adaptive techniques and equipment following a surgical procedure, such as total joint replacements, so that they can do things like get dressed and maintain their precautions. They can also help someone regain the ability to care for themselves following a stroke by improving function in the affected side, improving balance, safety awareness, visual skills, so many other things. Occupational therapy is the job of living.